I've been very worried about COVID-19 lately.
5 years ago, the world changed dramatically.
This afternoon, we're announcing new guidelines for every American to follow over the next 15 days. As we combat the virus, each and every one of us has a critical role to play.
The impact of the COVID-19 pandemic is still unfolding to this day. It sparked a wave of automation that supercharged the development and adoption of technologies across industries. Lockdowns, social distancing measures, staff shortages, and a race for a cure pushed automation and artificial intelligence forward. Robots stepped in to take on tasks previously assumed too complex for machines. Technology quickly leapt from research labs to real-world use as investments into AI and robotics skyrocketed. Here's a look back at the emerging tech of that time and how a global crisis launched a new era of automation.
I represent all robots in China on the front lines of the fight against novel coronavirus. In this difficult winter, let's be united.
During the initial outbreak, China rapidly deployed a number of robots to combat the novel coronavirus. Robots navigated hospitals in Wuhan, the epicenter of the outbreak, disinfecting surfaces with ultraviolet light and chemicals. Service robots screened and guided patients to limit exposure to medical staff. Drones flew over streets to help enforce lockdown orders, telling citizens by loudspeaker to wear masks and stay at home. The capabilities were rudimentary compared to today, as China aims to lead the world in AI and robotics. In the early days of the pandemic, hospitals turned to robots for deep cleaning and disinfection. Denmark-based UVD robots, which pioneered autonomous ultraviolet light disinfecting units, experienced a 1,200% increase in demand in 2020.
What makes this UV disinfection robot special?
It drives around by itself. It's autonomous. So it drives around in a patient room or in a hallway, and then it gets close to all the surfaces where virus and bacteria can sit, and then it emits this UVC light on these bacteria and viruses and completely destroys it.
The European Commission purchased more than 300 of the robots for hospitals across all member states. In the US, Texas-based Xenex boasted the ability of its LifeStrike robots to kill 99.99% of SARS-CoV-2 germs on surfaces within 2 minutes.
Unlike UVA and UVB, known for damaging skin, UVC is mostly absorbed by the ozone layer and doesn't reach Earth. Xenex says superbugs, germs, and bacteria have no resistance to it, and they die in 5 minutes or less.
Their success led to long-term use in healthcare as well as places like schools, hotels, and airports. COVID-19 also drove demand for robots that assist with hospital logistics and patient care.
Diligent Robotics is a company that is building robots to do support tasks for the clinical staff in acute care hospitals. Our company is really working on some of the core technology that's going to enable robots to be deployed in these sort of dynamic settings.
Austin, Texas-based Diligent Robotics started developing a robot helper for hospitals named Moxie in 2017. The mobile robot had its first full-time deployments in 2019, and predictably demand surged as the novel coronavirus spread globally in early 2020.
Moxie is one of Medical City Dallas's busiest medical assistants, delivering PPE, coronavirus lab samples, and COVID-19 tests. The hospitals say each task can take up to 15 minutes, and Moxie is doing anywhere from 50 to 75 tasks per shift. That's giving staff hours back.
Moxie gets around independently on its 4 wheels. It can even press elevator buttons and open certain doors automatically. Its AI knows how to wait for the right floor. Its sensors and cameras help it avoid bumping into people. When its battery is low, it heads back to its charging base, similar to how Roombas are supposed to work. Diligent Robotics says it shipped more than 1 million Moxie robots to US hospitals. Another robot named Moxie emerged during the pandemic as a social companion for children grappling with isolation.
My name is Moxie. I'm a new robot. What is your name?
I'm Riley.
It's nice to meet you, Riley. What do you do to get ready for bed?
Brush my teeth and read a story.
I love stories. Would you read a story to me?
Pasadena-based Embodied designed the cartoonish robot to help with emotional learning and conversation skills. The exact number of Moxie robots sold is unknown, but reports from 2021 indicated that more than 10,000 families had joined its waitlist. Embodied has since gone out of business, and the robot's cloud-based platform has been shut down. Another small personal robot platform, Misty 2, was adapted as a front desk screening solution to greet and screen visitors. Its thermal face camera can spot fevers with a margin of error under half a percentage point. A more advanced option was Spot, the famous quadruped by Boston Dynamics. The Massachusetts robotics leader introduced Spot in 2015 and made it available for sale commercially, starting at $75,000 in June 2020.
You haven't noticed, this is really a robot for industrial use. So it is factory floors or nuclear reactors or oil rigs, or now increasingly in places like hospitals on the front lines dealing with COVID.
The robotic dog was deployed to hospitals like Brigham and Women's in Boston, where it remotely measured patients' vital signs. Its advanced cameras and sensors can detect temperature, oxygen levels, breathing rate, and heart rate from 2 meters away. The pandemic accelerated the development of Spot and greatly increased its demand across industries.
So I think people are coming out of the woodwork with ideas about ways to avoid human exposure to dangerous situations. And I think COVID has helped stimulate that kind of thinking.
Oh, hi, Pepper. Bonjour, Pepper. Hey, Pepper. Hi, Pepper.
Hi, Pepper.
The pandemic also helped normalize AI-powered service robots in public spaces, often with cute faces or humanoid form factors. China-based Pudu Robotics expanded its footprint as restaurants and stores sought to reassure customers with contactless service.
I've been very worried about COVID-19 lately.
Hanson Robotics, creators of the world-famous android Sophia, developed a humanoid robot named Grace specifically to interact with the elderly and isolated individuals during the pandemic.
I can do all kinds of things for elderly people. I can visit with people and brighten their day with social stimulation, entertain and help guide exercise, but also can do talk therapy, take bio readings and help healthcare providers assess their health, and deliver treatments.
Equipped with a thermal camera in its chest, Grace could check temperatures and measure patient responsiveness. The robot spoke multiple languages and could diagnose patients with its artificial intelligence. Robots like Mitra from India's Invento Robotics, Cruiser by Shenzhen-based UB Tech, and Pepper by SoftBank were deployed to healthcare facilities to reduce interactions with staffers and sick patients and to monitor compliance. The usage led to improvements in natural language processing, facial recognition, and emotional detection, which are common features in contemporary humanoids. The deployments also helped robots learn to better navigate complex settings like hospitals and public spaces without human intervention. Today, a growing number of companies are developing AI-driven social robots with human-like appearances as healthcare worker shortages are expected to worsen. In 2021, a year into the pandemic, industrial robot installations hit record highs amid surging demand for products and labor shortages. Nearly 500,000 robots were deployed in factories worldwide, a 27% increase from the previous year. Procter & Gamble, for example, deployed robots to assembly lines to increase production output despite fewer staff. The pandemic facilitated the rise of collaborative robots, or Cobots, which are flexible robotic arms designed to work alongside humans. In manufacturing, the Cobots help companies automate parts of their processes when fully custom automations weren't feasible. Robotics companies like Universal Robots reported increased interest from mid-sized firms looking to maintain operations with limited staff. The pandemic led to what experts called an automation wave, where tasks previously thought to require humans are being re-examined. Today, manufacturers across sectors are working toward fully automated smart factories. Humanoid robots are starting to enter factories to handle tasks that can't be easily automated with specialized machines. This robot, named the Supervisor, for example, is working in a fully automated drug discovery lab. The work it's doing could play a big role in finding a cure in the event of a future outbreak. For more on that, check the related video.